This lecture in our Anatomy and Physiology series focuses on the axial skeleton. Here's an outline of what we will discuss today. We will review the components of the axial skeleton. There will be a brief description of skull anatomy. We will discuss the vertebral column. The typical anatomy of a vertebrae will be described. Furthermore, we will describe the anatomic differences for each section of the vertebral column. We will also discuss anatomy of the sternum and ribs. Let's talk about the axial skeleton for a minute here. So if you recall, the axial skeleton consists of the cranium, also known as the skull, the vertebral column, the ribs, and the sternum. And you can see that clearly in this color-coded picture. Everything that's in blue is the axial skeleton. Now let's look at the cranium. We will look at the bones of the cranium. So let's look at the side view. You can clearly see the frontal bone, the parietal bone, the temporal bone, the occipital bone, the mandible, the maxilla. And the maxilla forms the center portion of your face. Then you have smaller bones, such as the lacrimal bone, which you can't really see that well. There's also the nasal bone, which of course forms the nasal bones in your nose. You also have the ethmoid bone, which is not as clearly visible on the outside as on the inside. You have your sphenoid bone, and you have your zygomatic bone. The zygomatic bone is also known as your cheekbone. And here's just a different view of the bones from the side, from the front, I mean. And you can take some time to review this for yourself. But as you can see here, the maxilla forms the center portion of your face. You got the mandible here. You got the frontal bone, which is, as you've guessed, in front. Temporal bone, parietal bone, sphenoid bone, your cheekbones, your zygomatic bone. Now let's talk about the vertebral column. The cervical spine consists of 7 vertebrae, and in general, in mammals, all mammals, from a giraffe to a human being, have 7 vertebrae. And these vertebrae are named C1 through C7 based on number. And C stands for cervical. So see right there, you've just learned 7 bones. The thoracic spine consists of 12 vertebrae, which are named T1 to T12 based on number. And the T stands for thoracic. See, you learned another 12 bones. The lumbar spine has 5 vertebrae, and these are named L1 to L5 based on number. You've learned another 5 bones. Then you have your sacrum. The sacrum is actually the fusion of 4 vertebrae, but these 4 vertebrae have formed 1 bone. The coccyx, which is here, are composed of 3 to 5 fused vertebrae. Now let's discuss the typical structure of the vertebrae. And we're discussing the typical structure because depending on the section of the spine, there may be some variations, which we will go into later. So each vertebra has a vertebral body and a vertebral arch. This is the vertebral body. Everything behind here is the vertebral arch. The vertebral arch consists of the spinous process, which projects posteriorly. It consists of the transverse process, which projects transversely, which is why it's called the transverse process. we have the lamina, which is located between the spinous process and the transverse process. We also have superior and inferior articular processes, also known as facets. Here you can only see the superior articular facet because you're looking downward. And there's also a pedicle, which is between the transverse process and the body of the vertebrae. And if you think of the term pedicle, the pedicle means a stem. Pedicle means a stem. So just think of it as a stem holding up, think of these two as stems holding up the vertebral arch. Then we have the vertebral foramen, through which the spinal cord passes. Then we have the intervertebral foramen, which is the foramen between two vertebrae. And we have intervertebral discs, which is the cartilage between two vertebrae. Now let's talk about the cervical spine, because there are some structures that are unique to the cervical spine. Now note that C1 is called the atlas. C2 is called the axis. Let's talk about the atlantoaxial joint. The atlantoaxial joint is the joint between C1 and C2. Just think of the world, C1, the atlas, rotating on C2, which is the axis. So just remember, the world rotates on its axis. C1 rotates on C2. C2 contains the odontoid process, which is otherwise known as the dens. C1 rotates on the odontoid process of C2. Let's look at the cervical spine some more still. The occipital condyles of the skull sit on C1. So what I'm trying to say is that the base of the skull sits on the first cervical vertebrae. This is how your head attaches to your neck. That's what I'm trying to say. All cervical vertebrae contain transverse foramina. The vertebral artery passes through the transverse foramen, except for C7. So here's your transverse foramen, or foramina, plural, right here. Transverse foramina are only seen in the cervical vertebrae. And as their name suggests, there are foramina located in the transverse process of each cervical vertebrae. And if you take a look here, you can see the vertebral artery coming off the subclavian artery and traveling through the transverse foramina of the cervical vertebrae. Let's look at the thoracic spine. All thoracic vertebrae articulate with the ribs, and each rib articulates with the thoracic vertebrae in 3 different places. Each rib articulates with the thoracic vertebrae above it and the thoracic vertebrae below it. The rib also articulates with the transverse process of its associated vertebrae. So going into a little more detail, if you take a look, the head of the rib articulates with the facet for the vertebra above it, as well as the vertebra below it. So the 8th rib articulates with the facet of T7 and T8. The tubercle of the rib, which is this right here, a tubercle is just like a bump coming off the rib that articulates with the facet of the transverse process. So it articulates with the transverse process here, and this vertebrae and this vertebrae here. So 3 places of articulation. And here's another picture that shows it from a different angle. You got the head of the rib articulating with the facet of this vertebrae here, and the facet of this transverse process here. And here, again, the rib articulates with the vertebrae above it and below it. So I think these pictures get the point across nicely. Let's look at the lumbar spine. There's really not much to say except that their vertebral structure largely follows that of the typical vertebrae. And as a matter of fact, the typical vertebral structure is based on that of the lumbar spine. I've included some pictures, so feel free to pause this video and review this picture in some more detail. Looking at the sacrum and coccyx, the sacrum consists of 4 fused vertebrae, and as a result, it has 4 pairs of sacral foramina, which are the equivalent of intervertebral foramina in other regions of the spine. So 4 paired foramina, 1, 2, 3, 4. And the sacrum articulates with the pelvis as well, right here, at the sacroiliac joint. The coccyx is a vestigial structure, which consists of 3 to 5 fused vertebrae. And when I say vestibular, basically means it's a useless. Back in the day when human beings were still evolving, it might have had a use, but now it don't. Let's look at the sternum. There are 3 parts: the manubrium, the body, and the xiphoid process. Take note of the jugular notch, otherwise known as the suprasternal notch. It's a depression on the upper portion of the sternum, and it's actually palpable if you feel at the base of your neck in front. The sternal angle is where the manubrium and the body of the sternum meet. And it's an important clinical landmark because this is where the second rib articulates with the sternum. So second rib, the one on the left articulates here, the one on the right articulates here. Let's talk about the ribs and the thoracic cage. The thoracic cage consists of the ribs, thoracic vertebrae, and the sternum. So you got your sternum, you got your ribs, and you got your thoracic vertebrae, which are partly obscured by the sternum here. The ribs articulate with the sternum by their costal cartilages. A costal cartilage is the cartilage that's associated with the rib. You have true ribs 1 through 7, which are called true ribs because they connect directly to the sternum through their costal cartilages. So like here, 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 and here. You have the false ribs, which are ribs 8 through 12, which their costal cartilages do not directly connect to the sternum. Furthermore, you have floating ribs 11 through 12, which do not connect to the sternum at all. And just recall that the ribs articulate with the thoracic vertebrae in 3 places. And I've already gone over this, so I'm not going to go over it again. We're done. I'm out. Like this video, subscribe. Thank you.